Vectra is an imaging device that we can use to morph a patient. And so commonly I use it in breast augmentation, where we take a picture of the patient and the computer program actually plots out all these measurements on the patient, and then based on that it uses an algorithm to either enlarge the breast, decrease the size of the breast, or lift the breast up. And so it can simulate doing all of those different procedures like a breast augmentation, like a breast lift, or like a breast reduction. And so patients get a very realistic idea of what they're going to look like after having the procedure. And they can play an active role in deciding the sizing process, which is very important to patients. Before Vectra, we often had a bra that had a pocket in it, and we would stuff the bra. So we would effectively take, early on, we'd use rice in a bag, and then as we got more sizers, we'd put silicone sizers in that bra, and you'd stuff it, and people would look in the mirror. But it was highly inaccurate, and so Vectra is a much better process for that. Vectra can be used for a number of different things. In my practice, I use it primarily for breast surgery, for rhinoplasty surgery, which is hugely beneficial because I can do a number of different things to the nose, make it smaller, make it larger, redefine the tip of the nose, and I can also use it for chin augmentation. So people that have a weak chin, you can simulate that, and again, it gives them a very realistic idea of what they're going to look like after surgery. When we do an exam for a patient, particularly for breast surgery, I will take my own measurements, but the computer program also does that. And so it's a way to double check yourself. And so based off that, it will make recommendations on an implant size. And so Vectra is just another tool that we can use in our toolbox to ultimately give patients a better outcome and give them the outcome that they desire. I think one of the huge benefits of Vectra is the patient gets to see kind of what their anticipated result will be. And ultimately that takes away a lot of anxiety associated with the procedure because you have, a visualization of what you're ultimately going to look like.